Welcome, Rachel Silverman. Thanks for joining us today on Medically Speaking.
Thank you for having me.
So today we want to talk a little bit about infusion as well as some of the clinics that Kaleida Health has in the community. If you can first start for our viewers out there, tell us a little bit about what infusion is. Maybe very common to those in healthcare, but what is infusion or infusion therapy?
Sure. So we have two infusion centers. There's one located at Suburban Hospital on the ground floor, and then we also have a location off-site on Spindrift Drive. The one on Spindrift is mainly for oncology and cancer care, so we'll do chemotherapies, immunotherapies, and different types of infusions where patients have either an IV or what's called a Metaport, and we infuse the therapies that way. And then at the hospital, we do infusions, and then we also do blood transfusions and procedure called therapeutic phlebotomy. So we have patients that come to the hospital infusion center for that.
I'm going to ask you a question regarding numbers or volume. Just give us a sense, give the viewers a sense of how many infusion treatments are done in one day. How long does it take? How many people are needed for a patient to take care of them? Give us some numbers here.
So we do, if we're talking about just at Spindrift, we do anywhere from 30 to 50 patients a day. So there'll be anywhere from 7 to 8 nurses on the floor. When you come up, we also have some secretaries and registrars that'll check you in. You'll see, just like at the hospital, there's the screening process at the front door where everyone's temperature will be taken. You'll be screened prior to coming in the waiting room. But once you get back into the infusion center, you could be there anywhere from an hour to, we have some patients that are there all day with us that are there, 8 hours with us.
So obviously a cancer care diagnosis and the follow-up treatment is an emotional, a very stressful time. What's it like for someone to have to go through an infusion therapy? What's the process? What's the mindset? So
it's, especially with a cancer diagnosis, but also some of the other infusions we see at Suburban, it's a difficult time. They bring out their family members. They spend a lot of time in the physician's office. The physician's office for Spindrift is actually right below us, and we communicate back and forth with them. But it's a difficult time for the patient and their families. So we just try to do everything we can to help them through their journey with it, especially when it's an oncology cancer diagnosis.
When you mentioned the word communication, or the communication that has to occur between either the patient, the physician, or the hospital and the patient, that's obviously a very important mechanism for the treatment process as part of the therapy. How has COVID-19 or the coronavirus changed that, impacted that? What has that done?
So it's changed, it's kind of added another layer. It's a difficult journey, a cancer diagnosis by itself, and COVID has added another layer for patients and their families. With cancer specifically, once they start therapy, their immune system is already compromised. So we're doing a lot of additional teaching, some of which they're used to, the social distancing, the avoiding large gatherings. A lot of established cancer patients are used to that. But for new patients, we're doing kind of all the COVID safety measures in addition to the normal cancer education that we provide when they come to infusion and when they go for their office visits.
So tell us a little bit more about the COVID safety measures. Now, for you, it may be, a regular occurrence these days, but for someone who may be going through this for the first time, or they're just kicking this off, they may think it's not a safe place to go to a hospital or physician office because there may have been someone with COVID-19 there. What are the safety measures that are in place that can help put the patient's mind at ease?
So number one, what we want to do is, protect the patients, and we want them to be able to get the care that their doctor has decided, they still need. And, we've been still seeing patients right along through this. So the first measure that we do an outpatient screening tool for any infusion patient. It's done anywhere between 24 to 72 hours prior to their scheduled appointment. And we go over if they've had a previous COVID positive diagnosis, and if not, if they've had any symptoms, fever, sore throat, shortness of breath, a new loss of taste or smell. And then if they have had any of those, we confer with the physician and decide if it could be COVID related or if it's more specific to their cancer. And then we go from there. We've also, normally we allow one visitor for all the patients, but we're trying to decrease the amount of people because the infusion center is more of an open, smaller space. So we've spaced out the waiting room, and we have visitors that come for new infusion patients, new cancer diagnoses, or patients that require assistance. But some other visitors for established patients are either waiting in the car or dropping patients off and coming back to pick them up, just to do everything we can to help try to protect the patients.
Sure. So an awful lot of work has gone in for the patient safety, for obviously the employee safety as well. A lot of measures taken there. But tell us a little bit why it's so important from a continuity perspective. Why is it so important for that patient to continue through with treatment during this time, or even from the provider perspective, the hospital perspective? Why is it so important that treatment continue despite all that's going on around us?
So the thing with cancer, it doesn't really ever stop. And every cancer is specific to the patient. So they may have two patients with the same diagnosis, but they might have other conditions that each other doesn't have. So every regimen is reviewed by the physician. And it's up to the physician if they want to change the frequency or combine any of the visits so that they decrease their times they have to come in. But basically the infusions have been continuing on very similar to before COVID, before the pandemic started.
As we wrap up here, any specific message or any other point you want to get across to those watching today?
The communication is really big right now because cancer is scary by itself, and it's even scarier with a pandemic going on. So to communicate with your doctors, the nurses, if there's any symptoms that you're not sure whether they're COVID or related to your diagnosis, to just either ask the infusion staff or the doctor, but just basically to keep the communication open. And if there's anything that you're nervous about, just reach out to us and we can help get the answers for you.
That's great. Rachel Silverman, nurse manager for the infusion clinics. Thanks for joining us today on Medically Speaking.
Thank you very much.